will be with you.
Thanks.
7 o'clock, 5 Live Sport, of course, but kickoff for that game is at 8 o'clock. It is 6:49, and if you thought bionic eyes were some sort of thing that only a superhero would have, think again. This is brilliant. An 88-year-old woman from East London has had her eyesight partially restored thanks to a microchip in her eye and some special glasses. Mahi Muqit is a consultant vitreoretinal surgeon at Moorfields Eye Hospital in London.
The chip itself is implanted inside the patient's eye. So visibly, it just looks like a normal eye. You're not aware the patient has a bionic chip there. And when they want to use it, they use these special glasses that they put on, and they're transparent, so it allows you to use the natural peripheral vision, and then it starts to activate the chip. So they're very lightweight. They're attached to a small computer on your waist, which is like an old Walkman, and they can then start to use the device. We train them to use the device in the clinical trial. So the hope is that they will take this away and use it both at home and when they're outdoors in social situations.
This particular patient, this lady that's had it done, she was suffering from an age-related degenerative condition, wasn't she? And is it something, or is this kind of pioneering procedure something that can be done with other conditions with the eye?
Of course, that's a natural question to ask, because there are many conditions where the center of the retina, which is called the macula, degenerates and is lost. So this particular trial will be aimed at dry macular degeneration. This is an age-related degeneration. However, the company themselves are certainly mindful that this device could be used in many other conditions where there's degeneration, such as inherited genetic conditions, especially where currently there are no treatments available for these conditions. So certainly that is an option for the future for patients, yes.
And in terms of this particular patient, just how much of a difference will it make to her life in terms of her quality of life?
Yeah, so that's a very important question for any patient coming onto the trial, because we do assess their expectations from what they hope to see using the device. And she herself currently has no vision whatsoever from that particular eye. She was previously a very active lady, so she's essentially wanting to try and get some form of vision back in the center of her field so she can start to recognize areas in her visual fields, start to pick up details, and she feels that this would certainly improve her quality of life.
Sounds incredible. And in terms of the microchip itself, you explain it as it goes into the eye, such a delicate procedure. Is this something that I guess has been years in the making? Give us an idea of the challenges that go into trials like this.
Yeah, I mean, the chip was actually invented in Stanford University by a pioneering lab, Professor Palanker's lab. And then it goes through many years of testing to check it works in the lab. And then it's taken up by a company in France who now developed the chip and the technology. So again, that's another 3, 4, 5 years. But fortunately for this particular device, it's actually been a much shorter lifespan, so that they managed to move to human trials much earlier. And because they've been very successful, we're now moving on to a much larger trial. So it's not been as long as other types of devices. So that's good for future developments.
And that was what I was going to ask next. In terms of this procedure, this treatment becoming more widely available, how realistic is that within the near future? If there are people that are listening now and thinking, wow, this could potentially change their lives, is it something that they could have in the near future?
Yeah, I mean, the clinical trial runs for about 3 years, and towards the end of the last year, you start to have the results from the trial. And once you have those results, you then try to commercialize the device. It takes about a year or so. And then you look at each health agency in the country, such as the NHS, and they previously did approve another device. So we think the door is open for electronic retinal chips for patients. And certainly if we have good results from this trial, we'll certainly have a very, very good case for proposing this as a treatment for dry macular degeneration, where, as I said before, currently there's no treatment available.
Do you know, Mahi, it must really astound you in terms of the advances medically when it comes down to vision, it comes down to eyes, because of course you're a surgeon at Moorfields, and in November there was a man there, became the first person to have a 3D printed prosthetic eye. And it's just, it comes on leaps and bounds, doesn't it? How far do you think that technology could take us when it comes down to the medics and eyes?
Yeah, I mean, in the last 2 years, I've seen gene therapy now become available for patients. We have colleagues in Moorfields working on stem cell transplants. There are new developments in electronic retinal devices, and people are very interested. We have specialist centres such as Moorfields, and we can move these along much more rapidly for patients. So there's certainly this huge unmet need that now we're seeing is being realised.
Well, great stuff. There's Mahi Muqit with just another technological whiz that could affect many lives as we hurtle towards the future. We're hurtling towards the past.